right, with the surge in holiday travel, we can expect a surge in new COVID cases. That's the warning from medical experts. So let's take a look at this. This time last year, COVID cases were at an all-time low with nearly 17,000 new daily cases. Today, what we're seeing 5 times that amount with more than 100,000 new infections. Dr. Frita Fisher is in studio with us. She's the founder and president of Midtown Atlanta Nephrology. Thank you so much for joining us. So, Dr. Fisher, I mean, we hear those numbers, 17,000 cases a day, 100,000 cases a day now. What is this telling us about the state of the pandemic?
It's telling us, Alex, that it's not over. We've been so excited, especially after Omicron, when the numbers went down and we were able to take off masks somewhat and be out and living in the world as if the pandemic weren't here. But it's a reminder that with the numbers going up to over 100,000 cases a day, and now the hospitalizations are increasing as well, we have no mask mandates on airplanes for the first time since the pandemic. And so if we're not careful, we could surge again and be right back where we were before during this Memorial Day weekend.
Right. So do you think that this is just something that we're just going to have to learn to live with? We're going to have to learn to just understand that this is going to happen every year?
Absolutely.
Okay.
COVID-19 is not going away. We were hopeful at the very beginning of the pandemic, but it's here to stay. We're just hoping that it will get to be endemic, where it's more static and predictable, but we're not there yet. And so we still have to use mitigation factors.
Right. So, of course, when we hear that big difference, this time last year, 17,000 cases, now more than 5 times more at 100,000 cases a day. This sounds scary to a lot of people, but what we have to keep in mind, too, though, is that, more people are vaccinated and boosted today than last year. So how does that factor into the way that we're handling the virus at the moment?
We're definitely in a better place.
Right.
So, yes, more people are vaccinated. Over 80% of Americans have at least 1 dose. And then many people have had exposure through natural immunity, natural infection. And so that's some immunity. Beyond that, we have some treatments now, like Paxlovid, some antibodies. Right. And so we're in a better position than we were before. But still, now we have less people wearing masks. People have more COVID fatigue, and so we have to balance it out and be careful. And yes, accept that it's here to stay, but we can still have good life. We just have to follow the science and act accordingly when the numbers go up.
And be cautious. You don't have to be scared to live your everyday life, but to just be cautious and well aware of what's going on. All morning we've been talking about Memorial Day travel, right? Getting on planes. I was on a plane last weekend. I had a mask on. The person next to me had a mask on, but the person next to that person did not have a mask on. Now, this is the first holiday that we're going to be dealing with, maskless air travel, a choice, right?
Right.
How should we, or should we be nervous about just how many more cases we could possibly get after this weekend of travel?
Well, not nervous necessarily, but aware and cautious. When you get on an airplane, chances are there's a greater than 99% chance that someone else on the airplane is going to have COVID-19. And so if you don't have on a mask, you're putting yourself at risk for getting it. And so even though others aren't wearing a mask, when you wear a proper mask, like an N95, a KF94, a KN95, you are protecting yourself from inhaling at least 95% of the COVID particles. And you want to make sure it fits properly, right? So if it's fogging up your glasses, you need to tighten it around the bridges of your nose. If you breathe in and you don't get a suction, it's not tight enough. So not to be nervous, not to panic, but to be aware, be smart. And when you're in areas with moderate to high transmission, such as at least 1/3 and up to 45% of the places in the United States right now, go ahead and put on that mask when you're indoors, especially when it's crowded.
Yeah, good tips there. So the dominant variant, Omicron BA.2.12.1, how does this variant compare to other ones that we've seen so far?
Well, it's definitely more contagious. It's more transmissible, which is why it's become the dominant variant. But the good thing so far, it does not look like it's more deadly, like it's causing more hospitalizations, more deaths. It's not more virulent right now. And so if we still utilize the mitigation factors that we know about, masks, vaccinations, boosters, then we can still survive in a somewhat peaceful way, but we have to be smart. So something to pay attention to worry about, but again, not to panic.
All right, Dr. Frita Fisher, thank you so much for joining us.